Welcome to On the Beat. I'm Linda Colson, your host, and today we're going to be speaking with a couple of doctors from Gastroenterology Associates of Columbus and Starkville. And today I want to introduce to you Dr. William Gillespie and Dr. Hurd, and we're going to be talking about IBS. What does that stand for, first of all?
It's Irritable Bowel Syndrome. It's one of the most common GI problems that we all have.
That is so true. And tell me what exactly that is. What is IBS?
IBS is, it falls into the umbrella of what we call functional bowel disorders. That means things just don't quite work right. So it's not something like a blockage or an ulcer or something we can go in and take a picture of. It's just that your intestines aren't working quite right.
What are some of the symptoms of that then? How would I think, oh, I might have that? Can you tell us, Dr. Gillespie?
Yeah, well, most of the time you have either constipation or diarrhea most of the time when you have bowel movements. Sometimes
Okay.
you can have both. It can flip-flop back and forth. Frequently you'll have some abdominal pain and cramping that usually gets better after you go to the bathroom. And frequently it can be associated with stress, so if you get really stressed out or very anxious, it can make your symptoms worse.
Well, I've heard too that there's a type of spasmodic, reaction as well, and it can be very painful. Is there a cure for this? What can you do for it?
There isn't a cure.
Okay.
There are treatments. So mostly what we do with IBS is symptom management. First, especially depending on your age and what exactly your symptoms are, we're probably going to do some workup to make sure that there aren't other things going on at the same time. Make sure we're not overlooking some more serious diagnosis. And then once we get to that, then once we're comfortable that you're okay and this is IBS, then we focus on symptom management with medication, with diet changes. There are a lot of different things that we can
Something
do
that
for
can relax the digestive system some so that you don't have the cramping.
Sure,
Yes.
the cramping is more of the pain component with IBS, and there are medicines that help relieve that spasm for sure.
Okay, are there other treatments available other than just the medication?
Yeah, diet is the big one.
It is?
Yeah, so we're going to go over a big lifestyle change with you if you're diagnosed with this. We're going to look into, are you eating a lot of fast foods? Are you drinking a lot of sugary drinks? How are you doing from your day-to-day life? And then we'll adjust your diet to help you.
So you are saying that this is fairly common, and do you find it more in young people or just pretty much across the board? Anyone can experience this?
Kind of see it all over the place, all ages, all races, everybody gets affected by it. And it's very, very common. A lot of people don't like to talk about it, but it's something that a lot of people have.
Does hereditary play any role in your propensity to having
It seems
health
like
issue?
maybe it does. I don't know if we have any hard evidence to that,
Yeah.
but it does seem like it might.
might have a
Certainly
little bit to do with it?
lifestyle is, passed
biggest issue.
down, so if your parents aren't eating healthy, you're probably not eating healthy too. So I could see how those two
Yeah,
could go.
there's so much focus now on eating healthier, and it's not just the pill anymore that's that fix. We really do need to go back to the basics and getting a good diet and everything. Thank you so much, Dr. Gillespie and also Dr. Hurd. They are wonderful. They're part of a 5-doctor associate complex of certified gastroenterologists here in Columbus and Starkville. Be sure to visit their website. You'll find an education section, and you'll meet all the staff, including their nurse practitioners as well. Thank you for joining us today.